died and thousands have tested positive for coronavirus. Letters are being sent to retired doctors and nurses about returning to the National Health Service to help with the novel coronavirus pandemic. And schools will be closed indefinitely later today. Stuart Smith has the latest from London. He joins us now live. Hey Stuart, a very good morning to you. So schools scheduled to close today. And something that strikes me in terms of, roping in more doctors. When we crossed our correspondent in Italy yesterday, she was talking about, roping in student doctors to help in. Is the situation that dire there in the UK?
Well, it's the same sort of idea. 65,000 letters have been sent out to retired doctors and nurses if they've retired in the last 3 years, but also students. So final year medical students will also be asked whether they can help with basic services like looking after patients or answering phone lines relating to advice on the coronavirus. And the government's hoping that with the extra numbers that come in, that the government will have a better chance of managing this coronavirus epidemic.
So with regards to the schools, Stuart, are all schools closing? Because reportedly the UK Education Secretary was saying that children with a social worker will still be able to go to school. Could you give us some clarification with regards to that?
Yeah, it's quite an extensive list, actually. It's not just, say, for example, children with social workers who can't go in, who will go in, but also children with parents who are in key sectors. So it's quite a common sense list, as you'd expect: nurses, doctors, bin men, for example, but also people like bankers, IT managers, anything really that keeps the economy going, which could be quite an extensive list, and in some parts of the country could end up meaning many children still end up going to school, because all services have to continue as normal for the country to be effective.
Talk to us about life as we know it in London in particular, and generally in the UK, with regards to people frequenting restaurants, pubs, etc. What's the latest with regards to that? Is it still carrying on as normal?
It's not carry on as normal. The advice is not to go to places like pubs, cafes, restaurants, bars. However, it is still advice. So people are still going, not many I should add, and also these places have not been closed, which puts them in a really tricky position. Do they open and hope for just a few customers, or do they just decide to close now in the face of ever-dwindling numbers?
Talk to us about the economic impact of the COVID-19, Stuart. Hundreds of billions has been spent on a stimulus package, I understand, to try and protect the workers and the economy. But there's been criticism. It's still not enough. What else is government doing?
Yeah, hundreds of billions of dollars, 15% of the country's GDP, and still criticism from the Labour opposition party that is not enough. And not just not enough, but it's not being given out quickly enough. There are businesses that would like to apply for the loans the government promised, but they still cannot apply for those just yet. And for some businesses, they need this money now. They need it really quickly to keep going. So one thing the government may be looking at in an announcement expected later today is some kind of wage grant to workers who may be laid off. This has already happened in Denmark, in Portugal, in Austria, where the government pays 70%, in some places 85%, of workers' wages, and then the business just has to pay the rest. We're expecting an announcement on more economic measures, potentially something like that later on today.
You in a city that reportedly has the most number of cases or deaths rather from the COVID-19, correct? Talk to us about the latest numbers that are coming through.
Yeah, so London is considered to be weeks ahead compared to the rest of the country in the spread of the virus. In London, about half of all cases in the whole country have been seen here. So 144 is the latest death toll, and it tends to be doubling every day, which is quite consistent. It's with what epidemiologists are expecting, but very, very quick increase. And we are now very firmly into the speediest part of the pandemic stage.
Yeah. Stuart Smith, thank you very much indeed for your reporting. Stuart Smith coming to us live from London in the UK. All right, I want to remind our viewers with regards to